affected an estimated 262 million people globally. Asthma prevalence in India. In India, the prevalence of asthma is estimated to be about 3% in adults and between 4% and 20% in children. Asthma prevalence in Saudi Arabia. A study in Saudi Arabia recruited 2,405 participants to complete a questionnaire. Question about asthma medication effectiveness. When treating asthma, it may be necessary to reduce the dose of inhaled corticosteroids, ICS, by 25% to 50% or stop any other long-acting medication to confirm an asthma diagnosis. Roflumilast and its significance in the context of AST. Roflumilast overview. Roflumilast is a selective phosphodiesterase 4, PDE4, inhibitor primarily used in severe COPD patients, particularly those with chronic bronchitis and a history of frequent exacerbations. 7. It has shown modest improvements in lung function, FEV1, and a reduction in acute exacerbation rates, especially in patients with very severe COPD, Gold Class 4, and those with a history of hospitalizations 1, 3, 5. LABA and SABA overview. Long-acting beta-agonists, LABAs, and short-acting beta-agonists, SABAs, are bronchodilators used for symptom relief in COPD. LABAs are preferred for maintenance therapy, improving FEV1 and reducing symptoms more effectively than SABAs alone. 2. 6. SABAs are typically used for quick relief during acute episodes. Efficacy comparison. Roflumilast has been associated with a significant reduction in exacerbation rates in severe COPD patients, achieving a reduction from an average of 2.7 to 1.16 exacerbations per year. 5. LABAs, particularly when used in combination with inhaled corticosteroids, ICS, have also been effective in reducing exacerbations, but may carry risks such as pneumonia. 6. Side effects. Common side effects of roflumilast include gastrointestinal issues like diarrhea and nausea, leading to discontinuation in about 19% of patients. 5. 6. LABAs are generally well tolerated but can lead to cardiovascular side effects and increased risk of pneumonia when combined with ICS. 6. Patient selection. Roflumilast is particularly recommended for patients with severe COPD who experience frequent exacerbations despite optimal dual therapy, LABA plus LAMA or ICS. 3. 4. LABAs and SABAs are suitable for broader patient populations, including those with milder forms of COPD. Conclusion. The choice between roflumilast and bronchodilators like LABAs/SABAs largely depends on the severity of COPD, patient history of exacerbations, and tolerance to medication side effects. Roflumilast may offer superior benefits for specific high-risk populations, while LABAs/SABAs remain essential for overall management across various stages of a disease. Roflumilast's efficacy in treating chronic obstructive pulmonary disease, COPD, varies significantly between moderate and severe stages of the disease. Here are the key differences based on the provided search results. Efficacy in moderate COPD. Lung function improvement. Roflumilast has been shown to improve lung function in patients with moderate COPD, typically resulting in a modest increase in post-bronchodilator FEV1, forced expiratory volume in 1 second. 1. Exacerbation reduction. In studies involving moderate COPD patients, roflumilast has demonstrated a reduction in exacerbation rates, although the impact is less pronounced compared to severe cases. The overall reduction in exacerbations was noted, but not as significant as in severe COPD. 2. 4. Efficacy in severe COPD. Significant lung function benefits. In severe COPD patients, GOLD stage 3 and 4, roflumilast provides a more substantial improvement in lung function, with studies indicating an increase in FEV1 by approximately 97 milliliters over 6 months. 1. This improvement is particularly notable in very severe cases. Exacerbation frequency. Roflumilast significantly reduces the frequency of moderate to severe exacerbations in severe COPD patients. For example, a study found that patients receiving roflumilast had a 36% reduction in exacerbations compared to placebo, with rates dropping from 1.59 to 1.01 exacerbations per patient per year. 1.3. Long-term effects. The benefits of roflumilast appear to be enhanced with prolonged treatment, especially for those with a history of frequent exacerbations or comorbidities. 2. Conclusion. Roflumilast is more effective in improving lung function and reducing exacerbation rates in severe COPD compared to moderate COPD. While it offers benefits across both groups, its impact is particularly pronounced in patients with severe disease, making it a critical treatment option for those at higher risk of exacerbations. 11. Key challenges faced by asthma patients and gaps in current treatments. Persistent symptoms. Wheezing, coughing, and breathlessness disrupt daily life, especially with unpredictable triggers like allergens and pollution. Medication issues. Poor adherence and incorrect inhaler use lead to suboptimal outcomes. Up to 80% of patients misuse inhalers. Disease variability. Diverse asthma phenotypes and comorbidities like asthma COPD overlap, complicate treatment. Severe asthma. A small percentage of patients experience uncontrolled asthma despite optimal therapy, requiring frequent hospitalizations. Treatment gaps. Current therapies often fail to address individualized needs, with biologics being effective but expensive and inaccessible for many. Barriers to access. High costs and limited education worsen outcomes, particularly in underserved populations. Need for solutions. Emphasis on personalized medicine, improved inhaler designs, affordable care, and digital tools for real-time monitoring and adherence improvement. Some recent studies and breakthroughs related to roflumilast and asthma management include: roflumilast may increase risk of exacerbation in obese individuals. One study found that roflumilast had no effect on asthma control and may increase the risk of exacerbation in obese people with poorly controlled asthma. Roflumilast attenuates allergen-induced inflammation. A study found that roflumilast reduced allergen-induced airway inflammation in mild asthmatic patients. Roflumilast can significantly increase FEV1. A clinical trial found that roflumilast could significantly increase FEV1 and morning peak expiratory flow in a dose-dependent manner. Roflumilast can improve health-related quality of life. One study found that roflumilast improved health-related quality of life as assessed by the St. George's Respiratory Questionnaire Total Score. Roflumilast is a phosphodiesterase 4, PDE4, inhibitor that can reduce airway hyperresponsiveness, improve bronchial inflammatory cell infiltration, and reduce the levels of interleukin, IL-6 and tumor necrosis factor, TNF-alpha. Symptoms. Bronchodilation may cause increased heart rate. Overuse can lead to rebound worsening of symptoms. Long-acting beta agonists, LABAs, salmeterol, Ceravent, formoterol, improved lung function, reduced nighttime symptoms, risk of severe asthma exacerbations if used without an inhaled corticosteroid. Inhaled corticosteroids, ICS, fluticasone, Flovent, budesonide, Pulmicort, reduces airway inflammation, improves asthma control, potential for oral thrush, may require rinse after use. Combination inhalers, ICS/LABA, Advair, fluticasone/salmeterol, Symbicort, budesonide/formoterol, comprehensive management of asthma.